Osteoarthritis, or OA, is the most common form of arthritis, and the knee is one of the most affected joints. Of the knee is a chronic degenerative disease, which means it never goes away and can worsen over time. According to a new survey, all patients has tried some form of treatment to address their pain. However, 97% still report that their daily lives are negatively impacted by the condition. Dr. Brian Carr, an orthopedic surgeon, is joining us live from Las Vegas to talk about a new survey to show the non-opioid approach to managing pain. Good morning to you, Dr. Carr. Thank you so much for joining us.
Good morning. Thanks for having me.
Yeah, so let's talk about some of the trends you may be seeing with patients suffering from osteoarthritis.
Happy to. Osteoarthritis is a chronic degenerative condition, and when it gets bad enough, it can be quite miserable. And more patients are presenting to their healthcare providers each year to seek care. And the patients, younger and younger patients, are reporting to their healthcare providers for the same. And we orthopedic surgeons as a group are performing, several 100,000 total knee replacements for this condition a year.
And how does chronic knee pain or osteoarthritis impact people's lives on the daily? Like what types of tradition or symptoms are they seeing? What types of things are it impacting?
So knee pain, especially severe knee pain from osteoarthritis, impacts all areas of people's lives. It makes it very difficult to exercise or do the activities that they'd prefer to do. It causes them difficulty with work, particularly in laboring jobs. It disrupts their sleep, it impacts their social lives, it impacts their travel, and it's even impacting their mental health.
And how have people previously and traditionally managed that pain, and what are some of the treatment options available to them now?
So historically, people generally stop doing the activities that most hurt their knees. And if those activities aren't too numerous, people can get along, for quite a long time with that. They use anti-inflammatory medications like ibuprofen or naproxen, and that works somewhat, but you don't want to be on those medications for lengthy periods of time because they can have side effects. Some people even turn to opioid medications, which is a good temporary pain relief solution, but with our opioid epidemic, it's not optimal. You have increased risk of abuse and tolerance to the medications, particularly in the patients that are having mental health effects from their knee pain. Luckily now, iovera is a procedure that gives us an opportunity without medicine to have a major impact on their knee pain by freezing the nerves in the front of their knee where most of that knee pain is generated. Those nerves don't send the pain signals to the brain, and they have quite a bit of pain relief for 3 to 4 months.
And that non-opioid approach is, I'm glad you brought up the opioid crisis, because a lot of folks hearing about it and hearing about the impacts, that separates your treatments from some of the others that on the market for OA?
Yes, sir. In fact, the first patient I did this procedure on was a patient who was scheduled for a knee replacement. And I wanted to see how this procedure helped him get through the knee replacement. And after about an hour and a half after surgery, he got up in the recovery room and walked around like nothing had happened. And it was so impressive to the nurses there that they called me in my clinic and said, "What did you do to this guy?" And I've been using it on my perioperative patients ever since.
And those are the types of calls that makes it all worth it, and that's what you like to hear. Where can folks go to find out more information about any of the things that you mentioned here today?
iovera.com is the best place to find the information, but your viewers should know that knee pain, and particularly knee pain around surgical or knee replacement, can be miserable, and it just doesn't have to be.
Great information. Dr. Carr, thank you so much for joining us here on YC. We appreciate your time.
My pleasure. Thanks.